Welcome back to Dr. Khares Differential Diagnosis. Today we are going to learn normal or anatomical radio-opaque structure seen on intraoral periapical radiograph. So this is a mandibular radiograph showing two linear radio-opaque shadows of cortical bone lining the mandibular canal inferior to the apices of second molar. The thin white cortex forms the limit of developing tooth crypt. This is the mandibular radiograph showing genial tubercle. The lingual foramen is encircled by radio-opaque ring, which is shown by the arrow, which is produced by the genial tubercle seen in the radiograph A. The lamina dura antedentally forms the pointed alveolar crest, and B is the occlusal view of genial tubercle. This is the maxillary radiograph of ala of the nose. Ala is positioned over the apex of lateral incisor in the radiograph A, while in the B, the ala is seen in an edentulous patient. This is the maxillary radiograph of maxillary premolar region. The nasolabial fold, which is shown by the arrow, delineates the anterior border of the cheek. This is the mandibular radiograph of edentulous right mandibular molar region. The external oblique ridge is seen by the black arrow, and the mylohyoid ridge is seen by an open arrow. This is the mandibular radiograph of mandibular anterior region. The arrow shows a radio-opaque mental ridge. This is the maxillary radiograph showing coronoid process of mandible in the posterior maxillary region. This is the maxillary radiograph of posterior region. Series of arrow delineates the inferior aspect of relatively radio-opaque shadow produced by zygomatic bone. The anterior arrow indicates the radio-opaque U, which is the image of zygomatic process of the maxilla. This is the maxillary radiograph of posterior maxillary region. The hamular process is shown by the lower arrow, and the lateral pterygoid plate is shown by the upper arrow. This is the maxillary radiograph of maxillary molar region. The larger white arrow identifies the zygomatic process of maxilla. The black arrow indicates the zygomatic bone. The smaller white arrow marks the shadow of fibrous tuberosity. The thin opaque line in the superior right corner indicates the floor of nasal fossa. This is the maxillary radiograph showing maxillary sinus. In the radiograph A, the radio-opaque cortical line in this edentulous patient delineates a flat sinus floor. Radiograph B, scalloped appearance of the floor in a dentulous patient. This is the radiograph of maxillary posterior region. The horizontal radio-opaque line, which is shown by the arrow, represents the floor of nasal fossa, superimposed with the radiolucent image of maxillary sinus. This is the radiograph, maxillary radiograph, showing maxillary midline in an edentulous patient. The two arrow at upper half of radiograph identifies the inferior turbinates. The lower arrow indicates the anterior nasal spine. This is the maxillary radiograph of the premolar region. In this, the maxillary sinus is seen in the shape of Y. This is the maxillary radiograph of maxillary incisor region. The arrow denotes the soft tissue outline of tip of the nose. Paired radiolucencies representing the nasal chamber are evident at the upper edge of radiograph. The vertical radiograph shadow, radio-opaque shadow separating them is the nasal septum. The cortical bone forming the floor of nasal fossa appear as a broad radiopaque line.